Thank you for joining me today. In this video, you will learn autism spectrum, symptoms, treatments, assessments, and we are going to go over autism spectrum in a children. Autism spectrum is a developmental disorder and neurological developmental disorder with onset in early childhood. Characteristics of autism spectrum include persistent deficit in social communication and social interaction. It includes restricted and repetitive pattern of a behavior, interests, and activities. Symptoms include for autism spectrum include clinical significant function impairment. So the symptoms causes clinical significant and function impairment. Present across the multiple settings. This behavior and symptoms are present when the child in daycare or home it don't change because of the setting. It continues based on the setting, the daycare or school or home. Not better explained by the intellectual disability alone. So it affects many areas of the child. DSM-5 diagnostic combines forms of diagnosis like autism disorder, Asperger's, PDD into a single spectrum. The core diagnostic criteria include social communication and interaction deficit. Deficit in a social, emotional receptors. It limits the back and front of conversation, reduce sharing of interest and emotion. Deficit in a normal non-verbal communication, poor eye contact. The child will have a poor eye contact, limited gesture and facial expression. Deficit in a development. The child will have a deficit in development, maintaining and understanding a relationship. They will have difficulty adjusting behavior or to the social context. Trouble making friends. They will have a difficulty making friends because of their behavior and disability. This deficit must be persistent and pervasive. Restricted and repetition behavior is required 2 or greater. Stereotype or repetition is a movement and hand flipping, speech, use of an object, insist on a sameness, inflexible routines. They have distress with transition. The children have high restricted and flaccid interest, hyperactive or hyporeactivity to sensitive input, sound is they have a restricted sound is, texture, light, pain. This criteria distinguishes autism spectrum from social communication disorder. Developmental timing, symptoms present in an early developmental period. So autism spectrum symptoms present early developmental may become a more apparent as a social demand increases, more the child grows. The symptoms will be more clear because it's not acting like the way other children of his age or her age act. So it will be more clear that the child have symptoms of autism. They will have functional impairment. Clinical significant impairment include social impairment, academic functional impairment, occupational functional impairment. It has a 3 level of severity. So the severity of how autism spectrum are has a 3 levels. First level requires support. The child will require support. Second level require substantial support, so more support. Level 3 requires very substantial support. So more the level of severity is high, more require the child will need support. Associated features of autism spectrum include intellectual disability, which is common. They also have a language delay. They also have symptoms of ADHD. They may experience anxiety disorder, seizure disorder, sleep disturbance, GI symptoms. They have a GI symptoms. So differential diagnosis of autism spectrum include social pragmatic communication disorder, intellectual disorder, ADHD disorder, language disorder. Those are some of the common symptoms they have a common with this diagnosis. Repetitive behavior equal to autism spectrum. So if you see child is repeating behavior, same behavior, it may have ADS as autism spectrum. So how are you going to assess and diagnose that? You will assess the developmental history, direct observation of the child, speech and language evaluation. You will use those to assess if the child have autism spectrum. You will assess their developmental history. You will assess it. You will observe them directly. You will assess speech and language evaluation, cognitive testing. You will use cognitive testing. You will also assess hearing and vision screening. You will use standard tools like the ADOS, ADIR, spectrum, autism spectrum disorder. Treatment is early intervention, behavior, and educational interventionists are the first line. So the first line of treatment for autism spectrum is behavior and educational interventionists. Behavior and educational interventionists include behavior analysis, is the gold standard, improves communication, social skills, and adaptive behavior. So apply behavior analysis, improves communication, improves social skill, and improves adaptive behavior. Speech and language therapy helps the child. Occupational therapy like sensory integration will help the child. Social skill training are some of the interventionists. Individual education program can support the child of autism spectrum. Coordination and monitoring progress and psychoeducation. So the provider can provide a coordination, monitoring of the progress, and psychoeducation for the family and the child. There is no pharmacology or medication treatment for core autism spectrum. Risperdal is approved and Aberrant indicated for irritability, aggression, and severe tantrum. So the medication is used as other symptoms, comorbidity treatment, but there is no treatment for autism spectrum. Medication treatment, there is a therapy, but there is no medication treatment for autism spectrum, but this medication treat the comorbidity symptoms and irritability, aggression, and severe tantrum. There is a off-label medications that helps the symptoms if the child or the patient, if they have ADHD symptoms, stimulant and atomoxetine it's helpful. You will treat anxiety if they have them using the SSRIs. If they have aggression, you will use mood stabilizer. If they have a sleep disorder, you will use melatonin. You will prescribe melatonin. Those are off-label. It's not approved for FDA. family support and education. So you will train the parents, caregiver stress management, multiple disciplinary care coordination, prognosis. Prognosis is a variable. There is a variable of prognosis. Better outcome with the early diagnosis. Early intervention will improve the ability for the patient to function better. Higher language and cognitive ability. Autism spectrum is a lifelong, but the functional gain are common. So early treatment and early intervention can improve the functional. So autism spectrum is a social deficit with repetition behavior. Primary communication disorder is don't have a repetition behavior. So if the child have pragmatic communication disorder, they don't have repetition behavior. Usually antipsychotic only for severe irritability. So antipsychiatric medication is used only severe irritability disorders. Severity is based on how support needed. So if the child is having a severe autism, they will need more support. Thank you for joining me today. I would love to see you in my next video. Thank you.